Hello and welcome to Etna Talks. I'm your host, Juan Leiva, joining from the Universidad Autónoma de Barcelona in Spain. And today we're traveling to Ankara in Turkey to speak with a guest whose work bridges the gap between the hardest scientific realities and the most human forms of healing. We are joined by Dr. Nilgun Kuru from the Hacettepe University. Dr. Kuru is a scholar who isn't afraid of difficult conversations. She works on the front lines of the global refugee crisis, navigating deep cultural taboos to provide essential cancer care to Syrian and Afghan women. She studies the often overlooked role of men in family planning, and in a fascinating twist, she uses the power of laughter yoga to help survivors heal from devastating trauma like the Kahramanmaraş earthquake. She is a fellow of the European Transcultural Nursing Association and a true pioneer in public health. So, Dr. Nilgun Kuru, welcome to Edna Talks.
Thank you, Juan. It's really nice to be here, and I'm happy to join this conversation.
Oh, thank you so much. I'm sure we will have a lovely time. Uh, Nilgun, let's start with like the big picture. Turkey hosts the largest refugee population in the world, sitting right between East and West. For a nurse or a researcher in Ankara, this isn't just a statistic, it's daily life. How has this unique geopolitical position shaped your approach to transcultural nursing compared to your colleagues in Western Europe?
Yeah. I think in Turkey, this is something we experience very directly. Because of Turkey's position and the number of refugees it hosts, transcultural nursing isn't abstract for us. It is part of everyday care. And I start to understand this more clearly when I work in Hatay, near the Syrian border. There, refugees were part of daily life, and through my clinical experience, I saw the challenges were not only economic or related to the healthcare system, but
Mhm.
also cultural and social. And many of people we work with come from countries like Syria, Afghanistan, and Iran. So their cultural backgrounds and also gender roles and health beliefs quite different from Western European settings.
Yeah.
And I would say, yes, this makes our work a bit more complex compared to some Western European settings. So this means we are often working with very different cultural, and over time, I realized that providing care is not enough. We really understand the person, their contacts, and their daily life.
Mhm.
And actually, so many of my research topics today come from these experience in the field. Yeah.
Wow. I mean, it's fascinating. I mean, listening people doing real work in the real life of these people and improving nursing care. This is always fascinating to listen. And you have also done lots of research on gynecological health, breast health among Afghan and Syrian refugee women. These are cultures where I would say modesty is paramount, and discussing reproducing organs can be sometimes a taboo. How do you even begin those conversations? I mean, how do you do that? How do you build enough trust to talk about cancer screening without causing any offense to these women?
This is actually one of the most sensitive issues we face in the field. When you work with Afghan and Syrian women, you know the idea of modesty is not just a personal choice. It is very strong cultural value. So because
Mhm.
of that, you cannot really start directly with the topics, your research topic like reproductive health or cancer screening. As you mentioned that these are taboos, some culture. So you first need to build trust. One of the most effective ways we approach this was by working closely with the NGOs
Mm-hmm.
especially refugee associations. And you know, these organizations already have a strong connection with the community, and many women trust them. So, in many cases, we are entering an environment where that trust already existed.
Yeah.
We also collaborated with them during the research process and sometimes even worked together with people from these communities. And that really helped to us build trust even further. And maybe we can talk about the nurse's role. Of
Mm-hmm.
course, the role of the nurses is very important because you know uh, the way we communicate, the language we use, even how we present ourselves. All
Yes.
of these can affect how comfortable women feel.
Yeah.
So, yeah,
There are sometimes so many issues about nonverbal communication that sometimes we skip or we don't think about that, and they are so very important in establishing this trust and meaningful relationship with our patients or with our participants.
yeah, we usually begin with more general conversations like women's
Uh-huh.
health or daily concern, and then step by step, as the trust builds, we move in more sensitive areas because the goal is not to push or pressure, but to create a space where women feel safe and
Hmm.
understood. And once that trust is there, women become much more open to talking about their health also.
Hmm. And do you think it would be better if the interviews or the conversations are made by women or by men?
Yeah, for this culture, it is really better to woman and man
Woman.
to yeah,
Yeah, yeah. It will create like a non-safe space, I guess.
yes, that's
Yeah.
true. Yeah,
Wow. And also I know of another area of your research that is also, at least for me, is fascinating because it's in many times ignored and it's men. So you have studied the attitudes of refugee men toward family planning, and basically we usually focus only in the women. So what was the most surprising thing you learned about the male perspective, and are any barriers to family planning, or they have potential allies we haven't engaged yet?
yeah. That's a very important question. This was actually a very interesting part of our research because, as you mentioned, men are often overlooked in this
Hmm.
area. So, in this study, we conduct direct interviews with men, and one important decision, as you before asked to me, was to have the interviews carried out by a male researcher in our team. Yeah, he was also a nurse working with a refugee association, and he had a master degree in public health, so it
Uh-huh.
helps to us very easy. And I think that made a big differences because participants felt more comfortable and spoke more openly. One of the most striking things we found, men play a very important role in family planning decisions. In these cultures, in many cases, even if women have access to healthcare and know about family planning methods, they may not able to use them without their husband's support.
Uh-huh.
It is
Wow.
impossible. So this clearly shows that it is not realistic to see family planning as only a woman's responsibility. And I want to explain one thing. We also saw that the desire to have children plays a
Hmm.
big role,
Hmm.
especially in this culture. In some cases, many refer not to use family planning methods because
Uh-huh.
they want more children. And in some cultural contexts, having a male child is especially important. So families may continue having children until they have a son. So
Yeah.
you can see a lot of children in a family. But at the same time, migration can change perspectives. Some men told us that after moving a new country, they realized that having many children can create serious financial challenges.
Yeah, yeah.
Yes. And because of that, some become more open to family planning. They want to learn. And another important issue was lack of accurate information. Many men don't learn from healthcare professionals because they are at work. They learn from family members.
Ah,
Yeah, and this can lead to misunderstanding,
of course.
especially about side effects, which creates fear. And so this really highlights the role of health professionals. It is not just about giving information, it is also about how we communicate and whether we consider cultural values.
Yeah, totally agree. And also talking about transcultural communication, I understand that it's not something spontaneous, something like it has to be prepared. I mean, we need transcultural communication training, and we must know how to do things. It's not just because I am who I am, because I am so natural or so friendly that I am a good a transcultural communicator.
Yeah, you are absolutely right. Yeah. Yeah, I want to explain that men are not only barriers, they can also be strong allies, but
Hmm.
only if we include them.
Yeah,
Yeah.
sure. Yeah, it's a matter of inclusion. Yeah, it's true. And but now I'm going to change totally the topic. I mean, I know. I mean, we have spoken about your academic research, and but I also know that you are a certified laughter yoga. So we're changing the topic. Uh, that is, I mean, this is a huge contrast. How did you discover laughter yoga as a clinical intervention? And how do you explain the science behind it to those skeptical colleagues?
Yeah, I'm glad you asked that. I actually discovered laughter yoga during my PhD. I
Mhm.
used it as an intervention in my research, looking at its effect on older adults living in nursing homes. And in fact, it was one of the first doctoral studies in Turkey that examined laughter yoga as a nursing intervention. Yeah.
Uh-huh.
And during that time, it I also had deal with a kind of cultural resistance. Yeah, I remember people saying things like, they are older adults, do they really need laughter right now or something else? And that reaction actually showed me something important, that laughter is often underestimated.
Yeah.
But in reality, it plays a significant role in psychological and social well being. And also, laughter yoga is more structured than people expect. A typical session including clapping and breathing exercise to build energy and some playful activities to help people relax. And then laughter exercise where people laugh intentionally even without a joke. And these both elements have a long background. Yoga, as you know, that has been
Hmm.
practiced for centuries. Yeah, and its health benefits are well known. And laughter, on the other hand, has also been studied scientifically and even discussed by thinkers like Aristotle, Plato, and Freud also used laughter techniques. And so when I explain these more spectacle colleagues, I focus I focus on this combination tradition and science. And also research shows that it can help reduce stress, improve mood, and support social connections. And also you can find there are some findings related to stress hormones like cortisol and
Wow.
increases in endorphins. So laughter yoga is not just something fun for me. It is complementary approach that can support well-being, and especially you can use it vulnerable groups. It is a
Hmm.
good info.
Yeah, and at the end, we are providing better care and I guess better outcomes as well. Um, and I have read also about your work with the Laffy, the laughter prescription app method. Tell us a little bit about this application and what is Laffy and how a nurse can prescribe it to a patient to improve their well-being.
Of course, LF is similar to a selfie, but instead of taking a photo, you create 1 minute video of your own laughter. In practice, it is really simple. A person records themselves laughing for about 1 minute and later watch that recording. And when they do, they usually start laughing again. So yeah, yeah. So it use contagious nature of laughter, and there is no strict way to do it. You can do it alone, with someone else, or even in a group. Some people like to make it more playful, using gestures, movement, or even just thinking about something joyful to help them laugh. And like any practice, of course, it can feel a bit unusual at first. I think all laughter-based exercise like this, but it becomes more natural over time.
Mm-hmm.
And in nursing, this is where it becomes really interesting. We can think of Luffy almost like a small prescription. For example, 1 minute of laughter 2 or 3 times a day. It is simple, low cost, and accessible. Everyone can
Yeah.
record your laughter video, and it can support stress management, improve mood, and enhance overall well-being. Yeah.
Yeah, and it's eco-friendly as well because
Yes.
there's no waste.
Yes.
Wow, it's amazing. It's amazing. And you have also applied these techniques to survivors
Yes.
of the earthquake, the Karamans Maras earthquake.
Mm.
It's a difficult to pronounce for me.
Yeah.
Karamans Maras earthquake. That was a tragedy. I mean, we all know about the earthquake. How can something like laughter therapy be used in the face of such deep grief and trauma? What and can you tell us what about the results of your intervention?
The Kahramanmaraş earthquake was truly devastating, not
Yeah.
only physically, but also psychologically and socially.
Mm.
We tested Bluffy in a small pilot study with earthquake survivors. Participants follow a simple routine, one short group session per day with me, and then repeating the exercise on their own. So, in total, about 3 times of laughter per day for 2 weeks. And the results were quite encouraging.
Wow.
Participants reported positive experience, and we also saw a significant improvement in their well-being scores. Of course, I want to be very clear about one thing. Laughter-based approach or practices are not a treatment for own trauma. They cannot replace psychological care.
For sure. Yeah.
Yeah. But rather, I see them as supportive tools, simple ways to reduce stress, create small moments of relief, and support overall well being. And for healthcare professionals, especially nurses, this can be a very practical way to support people in difficult situations.
Mhm.
You can use
And
it.
I'm thinking also it could be very useful for preventing burnout in the professionals, for example, like establishing sessions, I don't know, once every week and then practicing at home.
Yeah.
Yeah, I see like lots of possible ways of use it.
So we,
Wow.
we always forget smiling and laughter, but
Yes.
we need it very
It
much.
is true. It is true. It is true. Sometimes when my students arrive to the classroom and they are so with that poker
Sad.
face, and sometimes I say, "Come on, just give me a smile and let's begin the day with another vibration."
Yeah, that's
It is.
perfect. Yeah.
It is important. And
Mm.
Now that I mean, we know that many countries are now facing new waves of migration. Based on your years of experience in Turkey, uh, what is the number one mistake healthcare system make when trying to integrate refugee populations, and how can we avoid that mistake?
For my experience, I think one of the biggest mistakes is focusing only access.
Mm,
Of course, access to healthcare is very important. Yeah. Even if someone can reach a healthcare service, it doesn't mean they can really benefit from it. And this is where culture becomes very important. I want to give an example. When I was working in Hatay, I saw patients with chronic disease like hypertension
mm-hmm.
who were regularly visiting doctors and receiving treatment. So technically, they had full access to healthcare, but at the same time, I noticed that family members would sometimes secretly bring salt to them.
Oh,
Yes, because in their daily habits, eating without salt was very difficult. So even though the medical treatment was correct, it wasn't fully effective in real life. And I think these examples show something very clearly. If we don't understand people's cultural habits,
totally.
values, and everyday practices, healthcare cannot work as we expect. So, in refugee health, it is not enough to just provide services. We also need to understand the context people live in and adapt how we communicate. And this is exactly where transcultural nursing becomes so important
Mm-hmm.
because it helps us focus not only the disease but on the person.
Yeah, like the whole picture.
Yes, yes. And
Yes.
if we really want the healthcare systems to be more effective, we need to move beyond access and start building care, and that is culturally sensitive, community based, and based on real communication.
Mm-hmm. Totally agree. I'm thinking about the system in Spain. I mean, we have universal care and free care, and this is one thing, one mistake I think in most of the cases we make is that since health system is free, it's like everybody has access. But we have to think about linkage to care, for example, for those who come from abroad, the roles of the family members, the meanings of different practices. I mean, it's not just a matter of being free and universal, it's a matter of understanding what does it mean for them, and how can we help them to participate in their own care process. So I totally agree with you. Yeah.
Mm.
Okay, wow, Dr. Nilgun Kuru. I mean, we have arrived to the end of this conversation. I mean, I always say the same. I could spend hours speaking with my guests because it's. I mean, for me, it's like a life-changing opportunity. It's knowing from all your knowledge, your background, your experiences. I could spend hours and hours. So thank you for sharing your journey, your magical journey, I would say, with us. We have spoken from the silence of taboo subjects in the sound to the sound of healing laughter. So, I mean, so many things. I mean, your work is an inspiration. Thank you so much, Nilgun. Hope to see you in soon. And for our listeners, thank you for joining to Edna Talks, and remember that you can become a member of the European Transcultural Nursing Association for free, joining to the website and join to a network of professionals just like you, Dr. Nilgun Kuru. Thank you so much for having this magical conversation, and
Thank you
that's
so
all. See
much.
you soon.
Yeah.